Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. So, here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today it is my great pleasure to welcome Watanak Ly. Watanak comes to us from Cambodia. He's a highly educated nurse with a master's degree in health professions. Currently, he works for the UNICEF Cambodia Country Office as a social protection officer. And this includes social assistance monitoring under the public policy and public finance for children. He has worked for several international and local organizations, such as the Asia Foundation, World Health Organization, University of Health Sciences, among others, and he has held positions from technical advisor to mid-level leadership. His experience spans health education, public health nursing, health system strengthening, maternal and child health and nutrition, and he was nominated as an assistant professor by the Ministry of Health in Cambodia in 2003. So, welcome, Watana.
Hi, good evening from Cambodia and welcome and thank you for the opportunity today.
My pleasure, my pleasure. So, Watana, first thing I always want to know is why people are nurses. So, who or what influenced you to become a nurse?
Yes, that is, I think I can say that myself. So I can tell you the story on that. So actually, I was born with, a parent that my mother, she told me that she have asthma since she 18 years old, even she's not married yet during that
Yeah.
time. So after married and have my brother and until has me and so when I start, I know I mean that five to 6 years, I used to see her experience and difficulty in breathing and a lot of things more and Maggie. So every season, I mean, it happened twice or sometimes even third time a years
Yeah.
of this. Yeah. So it make me so difficulty and I start, support my mother like doing, housework and go to the market cooking since 8 years old and that. So I just wonder in my childhood, like what is disease and why my mother have a difficult in breathing, and then 1 or 3 days or sometimes 1 week after taking some medication or stuff, so it's gone and then come back again. And so I just keep in mind on that, and I just feel like one day I might can help her and support her of that, or even other people who have the same condition, but I don't know who will have this as well. And then, yeah, after I finished my high school, actually, to be honest, my goal is medical doctors. But medical doctor is very expensive, even in the school fee or what. And I was born in the poor family at this time. I need to work as well during study to earn some money for that. So I could not afford for this, but I tried to find a scholarship. Luckily, the nursing school they announced the government scholarship. So they
Okay.
pay tuition fee. Yeah. So the tuition fee is waivers. And I just, as I remember during that time, you know that Cambodia in the developing country and our big GDP is not really well. So during
Yeah.
that time, my scholarship stipend, I think it's just only during that time is about $5 per month. I think, yeah, it's just only that because it's long times ago since 2002, 2002.
Mhm.
Yeah, yeah. So, but the most important thing that I pay tuition fee. So I study for free. Then I get into the nursing school without any idea what is nursing for that. And after that, during that time, internet also very limited, and with the, I mean that the poor people, a poor family, so we have no own computers or what. So I try to save some money to get in, and I go to the internet shop and we rent them by hours. So if I'm not mistaken, during that time, 1 hour it's 50 cent. It have dollars on that. So I just go on this and I just put the measures that I don't know anything and just come to study. So what is that major? So I try to searching on this. At that time, my English also not good, but just a little bit, and I just learn it hour by hours English at other school from many people from other like the newspaper or listen to the radio during that time. I just try to search on this, and yeah, so I search with the American nurse and some Australian nurse, and those professional is inspire me. So I heard that nurses is like that. So they're not a doctor, but they're also part of the healthcare professional, and they taking care of the patient, and they can give some support, especially if I feel like they really a very good pair of the medical doctor. If I compare it to the general life, doctor is like a father and nurse is like the mother because nurses do a lot of things like a father on that time. So it will me more inspired. So I said that I need to do it from my heart. So I need to keep searching on it and then go on this. And during this time, I even heard about bachelor of nursing and then master of nursing and then doctorate in nursing, even PhD or what. But Cambodia, we only have associate degree in nursing. And
Okay.
at that time, yeah, and at that time, in my time, they don't call it associate degree in nursing as well. We studied 3 years, but they call it secondary nurse. So I mean
Yeah.
that the level, yeah, the level of professional at this time is very low. So it's just a secondary and do something that people know as a doctor assistant only, not a professional. It's like an assistant. Yeah.
Yeah.
But because of the searching, it inspired me more and give me more history about the nurse. And I start study about Florence Nightingale history and many other nurse hero. So it pushed me and pushed me until today. Thank you.
Awesome, 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 awesome. That is quite a story and quite a journey. How long did that take you to get through from discovering nursing to becoming a nurse and learning English along the way?
Yeah, I think I start use English proper or can feel like yes, nursing as a professional when I did on the third year. I nearly graduated, and then I have one opportunity to get into the internship at one hospital in Siem Reap. Siem Reap is very famous land of Cambodian. If you know or ever heard about Angkor Wat,
Mhm.
I'm not sure if you heard about Angkor Wat, so you can search it. It's very famous
Yeah,
World Heritage. Yeah.
yeah.
And then we have one hospital called Angkor Hospital for Children, founded by the Japanese people and some other, that Cambodian working there. And at that hospital, they really apply the nursing process in modern nursing care there. So, yeah, this is the time that I really touching and really clear that nurse is a professional. Yeah.
So now you were recently nominated, or last year you were nominated as an assistant professor by the Ministry of Health.
I meant that that's happened. My now, if I compare, if I count, since I graduated until now, it's already 18 years, 1 8.
18
Yeah,
years.
yeah,
18
18
years.
years. Yes, 18 years. And I become an assistant professor nominated by Ministry of Health last year. So 17 years. 17 years become assistant professor. But
Okay.
a lot of things and experience and pass by and so many things that sometimes I really feel down and sometimes feel hopeless, but it cannot cut me or get me give up for that. So I'm still strong. Okay.
So, what would you like to see? How do you think you can influence? Because as an assistant professor now, you're part of the education. How do you think you can influence the way nurses or how nursing is portrayed to the general public in
Yeah.
Cambodia?
Yeah. Thank you very much for this question and really important. Sometimes when talk about influencing, sometimes it's like, oh, we're proud of ourselves, but I'm not proud, but I'm proud. one step.
Yes.
Yeah. Yes. Uh, I'm really proud. Many nurses, even some of Cambodian nurses who are my senior, here senior age, or there's that more experience than that. But because of the assistant professor have criteria on this, the teaching experience, publication, and some other dedicated to the social. So I have become the first nurse background who become an assistant professor. I'm the first in the whole country. So this is thank you very much. So now I think several people is following. They just nominated this year. I heard that last month. I saw the prakat from the ministry. Yeah. So some more is following. But yeah, I'm proud of us the first. And what I feel that I can influence that is first can be a model for the new generation of nurses. So they will feel that this professional is not an assistant. This is a real professional.
Yes.
And also it depends on what you can show the society, what you contribute to the society, and you can show them you're strong. So you might be proud someday or getting that real recognition from the society or from other health professional. So all of the student might be can see the way that I achieve on this professional and also what I contribute. And it's the real truth because when I become an assistant professor or since I graduated a master of health professions, it will cover all other medical doctor, pharmacist, laboratory, midwifery in education. So I used to contribute in supporting of curriculum revision and also the competency framework development, standard of practice, scope of practice for those professional, even pharmacists or doctor. And in the university, some of medical students, when they study master or study other thing and they want to complete their research memoir or they want to complete their thesis, so they request me to support and become a thesis advisor or what. So it's not that I'm a nurse background, but I still can contribute and teaching a medical doctor or pharmacist or what, and that's it. Because it's not a matters of you are a nurse or what, but the important thing is how you can contribute, how you can contribute to the society, how you can support people, and especially for what you can share. So my slogan is love, share, and then care about other to get that to use their potential and to get into their goal and achieve their milestone of life and education.
Absolutely, absolutely. That is so awesome. So I
Yeah.
have a question because when you started out, you didn't even know what nursing was. So nursing predom actually worldwide, nursing is a predominantly female um uh arena. Yes. So in Cambodia, was it difficult for you as a male getting into this profession?
Mhm. Yeah. Actually, you are right. But in Cambodia, because if you study about the history of Cambodia, we passed by many wars, even the internal war like Khmer regime. If you heard about that, Khmer regime is start from uh, 1975 until 1979,
Yeah.
and then our Cambodian people was killed around 3 million people, and then
Mhm.
the human resource. That human resource is cut off and everything is down on this. So when we start again, so we have that that the slogan that we need to support each other, like who have more knowledge will teaching who have a middle knowledge, and that the middle level will teaching people who don't have any knowledge on that to
Yeah.
rise up our country on it. So at that time, and also it's my time, Cambodian is not really look like nurses is for female, dominant is for female or that. So it sounds like we come in the equality male and female. So in my case,
Yes.
yeah, it sounds like 50-50% on that. And then we also have, I mean that another reason, like when we met the patient who really need people who have really have energy, it's like a male energy to carry up and on. So that's why it become normal in Cambodia, whatever you are male or female, so you can enroll in the nursing course. And yes,
Awesome, awesome,
yeah,
awesome. Because
yeah,
there are some places that that's still a
yeah,
struggle for some men. So that's great to
yeah, yeah,
hear. That's
yeah,
great to hear.
yeah.
So here we are. We're in 2024, and I am in the US talking to you in Cambodia. And the ease of communication has naturally affected the way we learn from each other, actually, the way we practice. So how do you see technology influencing the way you practice nursing?
Yes, I think it very, I mean, it very huge impacted. The technology is now it really very much impacted. In the practice, even now in the hospital, Cambodia is not that modern yet, but we are moving. So even the patient record now we start using computers, and we also have some time learn about the uh, like telemedicine, and then even the teleconsultation, so we can consultation with the nurses, or no, with the patient, and doing some nursing visit via Zoom with other people. So on this, and the technology really have that impacted for us to improve our career, like searching. Yeah,
Yes.
because of the internet, because of the technologies that also help me today, that can understood well of the nurse professional and contribute more and learn much and go around, apply for the scholarship and go around the world to see how nurses around the world is rising up and have more a lot of things that to appreciate it. So technology is really important. And now we also started talking about digital now, but it's not really popular yet in Cambodia because it's just a startup. We just heard about digital now, and we not yet understand clearly how to use it on this. And I also still in the situation that searching about digital health and what can that digital health impact to the nursing professional or some other health profession works, something like that. So it's
Yeah.
really important. Yeah,
Yeah. Yeah. It's extremely important. Extremely important.
yeah,
It's
yeah.
impacting healthcare in so many different ways.
Yes, yes.
Yeah. One of the things that about one something about nursing, though, nursing is physically, mentally, emotionally demanding. What do you do to take care of you?
Yeah, to take care of myself. Yeah.
Yes.
For me, it's very short and easy. I mean that like daily productivity or daily moving, it's already I already count it. I already take care of myself.
Mhm.
It's been like yeah, every day if I'm open my eyes, can go to perform my duty as usually. Yeah, and I can make a communication with other people and can give them support. So physically, mentally, I'm okay on that. So I think that it's already uh, taking care of myself, and I try to low down a standard of living to myself, and I try to expand of my thinking in terms of passionate, in terms of sharing to other, and then focus on the support to others. So it feel I mean, it already happy to me. So this is a self care. So I can eat. And of course, I'm a coffee lover. So every day I can grab my coffees and I can go as normally to support people. And I already keep my dream and it's called my own theory in my personality. Like I brought it up from the nursing theory. Like I'm a people because my background is a nurse. So I should be a people who need to focus and taking care of myself and also other, not just only physical, but psychological, sociological. belief, and religious. So I carefully walk through any people, culture, diversity, and respect to their religious. Whatever my religious is different from them, but respect is the main important key. So I can go through, so make feel, and make peaceful in my mind. Yeah, and then try to control. Try to control the stress of ourselves. I believe that whatever we try, but people, human, we will have. That the downtime and stressful, but the important thing how we control it. So yeah,
Yes.
provide to the self care, or what I consider to my self care is, if I still product, I still operate daily, it's okay for me. Thank you.
So, if you look ahead, let's say 5 years, what do you think you'd like to see in nursing?
In 5 year, in the next 5 years, right? Yeah.
Mm-hmm.
I don't talk about global or to the development country, but talk about Cambodia, right? Yeah.
Yeah,
So
okay.
for the next yeah, so for the next 5 years, what I want to see in Cambodia is, I want to see a nurse receive a real recognition as a professional with their real authorized. That they can provide, getting more authority and getting more uh, opportunity to holding a a leadership position.
This is mhm.
Currently, yeah. Currently, we have some, but not many, and the highest is still in the deputy, not yet on the top. So in the next 5 years, I want to see that uh, more nurse can hold the top position to become not deputy director, but can be a director, can be a dean, can be like secretary of state, or even the minister.
Yes.
Yes,
Yes.
yeah. So yeah, and it's also, we need to push in the level of education. Currently, we don't have master degree yet. So in our country, for the level of education, we only have associate degree and bachelor degree. So I
Mhm.
also want to see in the next 5 years, the master degree is available. Even PhD in nursing is available. And one of the dreams, DNP. This is also my dream career. I want to see also the doctor of nursing practice in Cambodia as well.
Yes.
So
Yes.
so we can give more, and we can involve more with the PAC of primary healthcare. We can try to work on this, and also be a very important part of the to achieve the universal health coverage in 2030 as well.
Yes.
Because we is really important, and we are in the front line. As a nurse, we are in the front line. Every time nurses come first. But if we limit it all the right, if we limit it in position, so sometimes it really a struggle for us to move. So in the next 5 years, I want to get this. Even currently, I'm not really holding PhD or DNP yet, but I keep in the dream. Back to this. That I just said a little bit to my. That I I can proud that I with the nurse professional. I'm lucky to have an opportunity. To visit United States of America for 2 times. Uh, I used to study a sort called getting a scholarship from the U.S. government with the faculty scholarship to study a short course of public health epidemiology with at the UCLA. So
Mhm.
I visit the nursing school at UCLA, and I have time to visit uh, College of Nursing in University of Illinois Chicago, and I can see the simulation. The simulation setup, and so many amazing nursing education, nursing stuff, and it make me. I mean, make me. Get very in touch with the nurse professional and see how PhD and DNP can do it. Unfortunately, when I asked that and looking for that, they said that DNP is just for US citizen or at least residency.
Yeah,
Yeah,
yeah.
and there is no scholarship for this. So now we just keep finding scholarship, a PhD scholarship for that to get the dream. Yeah, so I hope that in the next 5 years, Cambodia can I mean that can move or can jump a little bit big
Yeah.
step. Yeah. Currently, we just finished one nursing curriculum revision, the associate degree, and the bachelor degree curriculum revision is on the processing. So it soon will be released. Before, we used content-based curriculum, but currently we divide it into the competency-based education curriculum. And I also one of the member who contribute there and become a technical working group for the revision of that curriculum. So I hope the next 5 years, a big change. Thank you.
I am confident that you will see that happen and that you will be a good big part of it.
Thank you.
I'm confident you'll be a big part of it. So before we go, if what advice would you give to someone who wants to be a nurse?
Yes. For the new generation, before they enter to the nursing school or nursing course, I would like them to reflect themselves first uh, by using of three words. If you love or you care, and you're willing to love, you're willing to care, you're willing to share, get in. Yes. So the nursing professional, you cannot study or you cannot practice nursing without love. In every step of nursing, there's an art and science plus together. So there's a love from your heart because like now in the modern thing, people love to say that 3H that nursing need to do like a head, heart and hand is very important. So they need to do everything with love. And then love alone is not really enough for that. You do anything with love, but if you don't care, your love is just a moment. But if
Mm-hmm.
you love and then you add up the care, so the I mean that the skill, your nursing skill, your contribution, your passion about that will be really strong and not easy to destroy of it with the love and care and to not just stay there, love and care. You need to share. Yeah. So if you really love that professional, you need to share that how nursing can contribute to the society, how important a professional nurse in the hospital, in the community, and wherever they work. Because the frontline and nurse work can work in everywhere, in the community, in the hospital setting, and like school, university, yeah, whatever, you need to share that and you need to let others know your strategy. So that's why my advice to them, build up and create your love, your care, and your share in mind first, and then you are the right one who should be in trained to the nursing school.
Thank you so very much for that. Thank you
Yeah,
so very much for that. It has been
yeah,
so great talking to you. I would love to do this again. I hope we
yeah.
can.
Yeah, yes. Welcome. Like I said, I love to share and my pleasures to share and to have you and to be in the nursing community and to share with all the nurse. My pleasures. Yeah.
Thank you so very much for talking to me today. It has been a real pleasure. Thank you.
Thank you very much. Thank you too.